Hello, I'm Dr. Bolanle, your host on the Bright Minds MD and your mental health podcast. Here, we discuss topics designed to explore the full spectrum of mental well being. You'll hear from experts and listen to personal experiences that inspire and inform. So, whether you're seeking insights, solutions, or just a dose of motivation, this podcast is your perfect companion. Hit that subscribe button and join us on this incredible journey to mental well-being. Your whole health starts with your whole mind. Let's get started. Me speaking here today to everyone listening, and I thank everyone who's taken the time to join us today to discuss this very important topic that I think that affects all of us in some way or the other. And I say that because it's something that's common. And even if we are not directly experiencing it, based on the statistics, it's highly likely that we know someone or we are in constant interaction with someone who is experiencing this kind of trauma. So thank you for joining us today. And my hope is that we can learn a bit more together and have all of us understand this topic a bit better and be better equipped to serve as resources in our communities to everyone who is affected. And for every survivor who is here today, I wanted to start by reminding you that you are beautiful, you are unique, and you deserve to be all that you can be. You deserve to be everything that you've been designed and proposed to be. And we hope that as part of our conversation in this program, we all are able to get closer to the beautiful version of ourselves that we've been created and designed to be. So thank you. As previously stated, name is Bolanle Akinrambi, psychiatrist at Bright Minds MD, a psychiatric practice serving New Jersey and New York, where we help people with depression and anxiety disorders and other psychiatric disorders feel better using fewer medications and wellness practices. Thank you. So, title of this entire program is You're Beautiful, and the subtopic, what we're looking at today, is understanding trauma and its impact on mental health. So I'll start by defining something. What is trauma? What is trauma? It's a word that we all hear a lot. What does it mean? What is trauma? Trauma is the emotional response to a distressing event. Through the course of human beings' lives, we all at some point may experience something that distresses us. The emotional response to that is what is called trauma. And I want to also just define, domestic abuse, because it's the highlight. It's the specific kind of trauma that we're talking about today. What is domestic abuse? Domestic abuse, also called domestic violence or intimate partner violence, can be defined as a pattern of behavior in any relationship that is used to gain or maintain power and control over an intimate partner. Okay. And I'm defining it broadly because some people are in this situation and don't even know that it applies to them. Why is that? Well, when we think broadly about domestic abuse or, intimate partner violence, what many of us think about is the physical aspect. That's what we know. The black under eye, someone who's being hit, someone who is being shoved around, the physical aspect. That's what was commonly talked about. But if we look broadly and more comprehensively at the experience of people who suffer domestic abuse, aside from the physical aspect, sometimes there can be sexual trauma, not often talked about, but something important that, affects a person, sexual trauma. There is economic and financial abuse as well, and trauma resulting from that, such as using finances, access to finances to control a person or to determine how they live or to make them, bend to this person in power's control. And it can go both ways, male or female. It can be the person who's financially able, who's being controlled, or the person who's not financially able, who's being controlled. this financial aspect happens in many different ways and presentation. But it is an important aspect of abuse that ends up affecting a person's overall well-being. Then there are threats of actions that influence another person, right? If you don't do X, then I'm going to do Y to you. If you don't do X, I'm going to harm your children in this way, right? Threats are a big part of domestic abuse and things that are used to, by the abusing partner to control the survivor in this case. And last but not the least, there is psychological and emotional trauma that is suffered, right? A person could use psychological means and emotional means to control a person and thereby cause them trauma. And as we've said before, trauma is the emotional response to a distressing event. So all of the things that I've listed ahead of time are potentially distressing events. And so the trauma that results from it is all of our emotional response to all of these distressing things that are happening in the context of domestic abuse or domestic violence. I like to throw in a little of statistics in here just to give us an idea of how much this impacts everybody, right? Because when we're talking about this, many, as PY was talking earlier, right? This is a program for everyone that everyone should, be keyed into, because it affects, if it doesn't affect us individually, it more than likely affects somebody we know, either somebody we live with, someone we're related to, somebody we work with, somebody who's connected to us in some way. And so it becomes super important to then make sure that we all at least are aware, we know how to identify it, and we know how to help a person who might be in this situation. The statistics is that in the US, right, there are, I think, 1 in 4 women and 1 in 7 men is estimated to have experienced severe physical violence by an intimate partner, according to the CDC. So if you think about those numbers, those are really staggering numbers. 1 out of 4 women, 1 out of 7. And domestic abuse can affect people of all ages, young or old, all genders, all types of genders, and socioeconomic backgrounds. So it's not limited to any type of person. It really can affect different types of people. So knowing that it can broadly affect people and how common it is and how present it is, I hope that highlights for us the importance of being aware of this and learning a bit more about this and being more in tune to what it looks like so we can know how to be of service or of help to people who are affected. I want to take a moment and talk about the nervous system a little bit, right? And I want to highlight the role of our nervous system. Part of the job of our nervous system, this network in our body, is to keep us safe. And part of that safety system is vigilance, preparation, and keying us into doing things that are safe. So that if, and for the most part in our living and day-to-day life, the expectation is that when we're in dangerous situations, say you're walking on the street, a car is coming, your nervous system will gear you up, ginger you to first see it, be aware of it. Adrenaline will go off, and this will cause your heart to pound. It will cause your breathing to go up. Your vision will sharpen, so that you can, if it's an approaching car, for example, you run away to get away to safety. Now, after that is over, your body's expected to settle down, reconstitute, go back to equilibrium, and you go back to living until another time when there is danger. However, what happens when we are perpetually, or when a person is perpetually in a state of anticipating danger, right? This is what happens in the case of somebody who is living in a domestic abuse situation, someone who lives with a partner, usually, who is physically, emotionally, financially, and in other ways presenting themselves as a danger to themselves. That means that person, the survivor, is living in a constant state of danger, a constant state of vigilance. And what that does to the body and the nervous system is that the nervous system stays in perpetual high alert, right? Our system is really not intended to be in perpetual high alert. We're supposed to, recruit those systems when there's something dangerous happening. It gets us to safety. We chill out and we go back to being, our day-to-day living. However, for a person who is living in a domestic abuse situation, because the danger is constantly there, like you're living with the danger, the person who can hit you, the person who can threaten you, the person who can do something terrible to you, your nervous system is perpetually revved up because now the danger is constantly present. It's like living with a lion. You cannot ever relax. You cannot ever fully sleep with your eyes fully closed. Your nervous system, such a person's nervous system will be perpetually high. And what that translates to are some of the psychological effects of trauma that we've talked about. And I will get into that detail in a little bit in terms of the psychiatric diagnoses that we see on, the psychiatric end of having your nervous system being perpetually up. But just on a short list, you hear diagnoses like PTSD, post-traumatic stress disorder. You hear generalized anxiety disorders and all similar anxiety disorders like that. There is also depression, right? Those are three of the common psychiatric diagnoses that we see in individuals who live in a domestic abuse situation. I'll get into that in a little bit, a few slides down. But I want to highlight, right, the voices of survivors, some survivors of domestic abuse or domestic violence. What do they report in their own words? What do they report from living in this kind of situation? A lot of people report guilt and self-blame. People feel responsible for the abuse and blame themselves for the action of the abuser. I caused it. I should have been quiet. I should have done this. I should have been more obedient. I should have done XYZ. Maybe if I did that, the person would not have done this to me. That's something that survivors report. Anger and irritability. So a person who is living, remember I said it's like living with a lion. You're constantly in danger and your nervous system is constantly up. So a person, a survivor of domestic abuse might feel very intense anger, irritability, sometimes directed at themselves, sometimes directed at others. So a person is at work flaring up at the smallest provocation or even for no reason at all. Maybe that's what's happening at home, but you don't know about it. A lot of people report shame and embarrassment. A lot of survivors feel ashamed about the abuse and they feel embarrassed to discuss it with others. So they hide. A lot of people don't talk to others because how can I admit that something this terrible is happening to me? Confusion. A lot of people feel confused especially because abusers tend to manipulate, gaslight, tell them, no, you're not seeing what you're seeing. No, it's your fault. No, it's you doing these things. So a lot of survivors feel confused about their own reality and experiences. They start to doubt, like, is this thing really happening to me? Did that really happen? They start to question their own reality. They start to lose doubt themselves, lose faith in their own assessment of reality. So, and this affects self-esteem down the line, because if you cannot trust yourself, how can you feel good about yourself fully? Isolation. A lot of survivors feel alone because they feel like maybe nobody understands what they're going through. They feel like people might judge them, so they feel alone. But some also isolate themselves because they don't want others to see them and judge them, or cause more problem for them, right? Say somebody sees them and decides to try to defend them, and then they still end up going home with the abuser. Then the abuser can further abuse them, which can make them further lonely and further isolated. So those are some of the things. In addition to that, there's also fear and anxiety, right? Living with a lion means you're constantly afraid. You don't know when something's going to pop up. It's just completely unpredictable. There's a lot of sense of powerlessness, right? If a person who's living in this situation can feel very helpless or unable to take control of their lives, especially if they continue to be in that situation, because in reality, the abuser is the person who's controlling when they can be at peace, when, there's just so much unpredictability in the situation. A lot of people feel numb, and numbness can happen as a traumatic response to perpetual, the barrage of different types of traumatic things happening: physical, sexual, emotional, financial, and so on and so forth. Sometimes our body tries to protect us by keeping us numb so we don't continue to experience that unpleasant emotion, unpleasant feelings. So numbness can be protective in a way, but also, not a very great way to live if you're numb in general. It can be a coping mechanism, to avoid the overwhelming emotions. There's low self-esteem, there's mood swings, there's depersonalization in some cases where people feel detached from themselves and they feel like this thing is not happening to me. They feel like they're watching it happen to somebody else. And sometimes that can also be a coping mechanism when the abuse and trauma feels overwhelming. There's also a lot of guilt that goes with that. A lot of, survivors feeling responsible for maybe collateral damage that happens to others, or maybe being able to prevent it from happening to other people. So those are some of the things that survivors report in their own words of what they're feeling and what they're experiencing. I mentioned earlier that we'll be talking about, in terms of psychiatric diagnoses, the things that, once a person eventually presents for care, the kind of diagnoses that are most commonly seen in survivors of abuse. So I mentioned earlier post-traumatic stress disorder and some of the signs of that. And I'm going to just go through that one at a time. So some of the signs of that would be flashbacks, nightmares, hypervigilance. Remember, I mentioned again, living with a lion, nervous system's job is to keep us safe. After living in a situation that's dangerous for so long, your body doesn't know how to turn off. So now it's constantly searching, constantly looking for the next danger, constantly replaying past experiences of danger in hopes to keep you safe. And so that's what people who have PTSD, that's what they experience. They're having flashbacks. They're having nightmares of the events. They're constantly looking around. They're constantly searching. They're constantly making sure that they're safe. And so this leads to this perpetual state of just being restless, being uneasy, being unable to relax. And that's what presents as the PTSD or post-traumatic stress disorder. Another common diagnosis that we see in survivors of abuse or people who are going through it actively, all kinds of anxiety-related conditions, generalized anxiety, perpetual worry, inability to rest, thoughts going, intrusive thoughts of all kinds, social anxiety, feeling uncomfortable in social spaces, panic disorder, which would be the heightened form of anxiety where a person feels like they may be dying or something really awful is about to happen, such that the heart will start pounding heavily. They'll run out of breath, feel like, they're really dying in the moment. Just this very overwhelming sense of doom happens. Tremors, feeling the need to run, like intense panic. It can be quite overwhelming, and it happening random times for some people, several times a day, several times a week, to the point where it affects their ability to function. It affects their ability to live on the day to day. It affects work environment and so on and so forth. So those are some of the psychiatric presentations. And also there is depression, right? Depression is, a set of symptoms comprising of perpetual low mood, sadness, loss of interest in things, inability to enjoy things, changes in appetite. Some people eat too much, some people eat too little, they lose appetite. Some people start spending their day sleeping because reality is just too painful. So a lot of people spend their entire time sleeping the day away. Some people are not able to sleep when they're depressed. So a constellation of those symptoms are sometimes accompanying situations of domestic abuse and the resulting trauma. So just to reiterate, PTSD, anxiety disorders, depression are three of the most common psychiatric presentations for people who are going through domestic abuse, domestic violence situations. Additionally, I've mentioned a lot of other things. There's emotional dysregulation. Sometimes that survivors lose ability to regulate their own emotions, and so they can have mood swings, happy this moment, sad this other moment, annoyed this other moment, dissociation, avoidance, hypervigilance. We've talked about a lot of these things earlier as well. So those are some of the signs. Now, If domestic abuse is so terrible, so damaging, so impacting, a question a lot of people ask is, why don't people leave? Why don't people leave? And there are a variety of reasons from person to person, but many of the reasons a lot of people don't leave have to do with shame, cultural pressures, right? What will everyone say? What will the community say? Finances. Maybe a person doesn't have access to money. Typically, as part of abuse, a person may be separated from finances. And so they may have no money to spend and nowhere to go. Children and dependents, right? Where do I leave my kids? What happens to my kids if I leave? And that's why it's really important, the work that TouchLink and similar organizations are doing to help bridge that gap, help with counseling with cultural pressures, teaching people, how to access finances, giving financial support until a person gets on their feet, finding a place in shelters for children and other dependents to help reduce the reasons, or to address the reasons why people don't feel comfortable leaving, or take the steps to leave, even though they are suffering in these situations. Actually, people start to feel it while they still are in the situation. Remember, people are like the nervous system, people are in danger in the moment while it's happening. So a lot of people begin to experience all of these things while they still are in the situation. And the sad thing is, even after they're out, the nervous system is still revved up and doing all of these things. So the experience can continue for much long after. But yes, it starts right while the person is in the situation, because in that moment, it's like living with a lion. It's like living in a dangerous situation. The nervous system is going to be doing what it does to try and keep you safe, which is to keep you hypervigilant, to keep you alert, keep you aware. Thank you. Okay. So I want to talk a little bit about coping strategies for survivors. Again, important for all of us to learn. We can use for ourselves, and also we can teach. Um, so coping strategies for a lot of survivors, or whether the person is actively experiencing it or have come out of it and in recovery. So self-awareness and recognizing triggers. Self-awareness and recognizing triggers is a really important coping strategy. And I think this is even important for many things, because the first step to solving any problem is realizing it. So when we start to do mindfulness practices to become aware of our own body, notice our own body's nervous system when it's revving up, noticing whether words or places or things trigger us, it's a good step then to start to be able to do something about it. So I would say the first thing is awareness and recognizing triggers. Another strategy that a person can use to cope, whether they're in or they're out of the situation, would be lots of relaxation techniques. And I'll go through a couple in a few slides down. Journaling and expressive writing is such a powerful and underutilized tool, because when we journal, when we write, we can process our feelings out loud. We can put things in front of us to understand what we're going through, have an understanding of it, process our own experiences, right? We can process with a therapist, but journaling is also a very important way to document our feelings, emotions, actions, things that have happened to us, but also allows us to process it in real time and offload it out of our minds. Because many times when we have things sitting on our head, it adds to mental burden, mental overwhelm. So journaling and writing it down is a good way to process our feelings, is to offload things from our brain. Mindfulness and meditation practices are also another coping technique. So I wanted to just highlight a few relaxation techniques, because sometimes people, when I say, relaxation techniques, people ask me, what do you mean? So I want to highlight a few common ones and easy ones that people can do and can learn on their own to regulate their nervous system. Because part of what we want to do, whether still in the situation or outside of it in recovery, is we want to start to help our nervous system regulate a little better. Because a lot of those, things we talked about, PTSD, anxiety, depression, a lot of them are related to now unregulated or dysregulated nervous system acting out when it shouldn't be, perpetually acting, as though we're in danger. So learning how to relax can really help us. And some common ones would be progressive muscle relaxation. It's a technique that involves tensing and slowly releasing muscle groups. And doing that promotes both physical and mental relaxation, and it's very effective for reducing physical tension. If you have a pen, I want people to get a pen out and list this. I can't like teach all of it in this session, but I think if you have the words, then you know what to search for. You know, like there are tons of public videos that teach people how to do these things. So if you want to get your pen out and write them down, and you can kind of get into it later. So progressive muscle relaxation is an excellent one. There's guided imagery, and that's using visual imagery or mental imagery to evoke relaxation. So typically people think of a safe place, a peaceful place, a comforting scenario, for, you know, and then you give your brain that image. And in doing that and repetitively presenting your body or your brain with that, it allows your body to de-stress, relax, feel less tense and less anxious. It helps regulate your nervous system. There is breath focus, a lot of breath work that teaches practicing deep, slow, and controlled breathing to reduce anxiety level. There's diaphragmatic breathing. The 4-7-8 breathing method can be very effective to learn to again regulate breathing. It's certain techniques of breathing that allows you to regulate your nervous system. Remember, it's one body. So what's happening in one part of the body, this time the mind, can affect the, you know, the physical body, but you can also vice versa use the physical body to regulate the mind. That's kind of the idea behind a lot of these relaxation techniques. There is aromatherapy, which is use of oils and scents. So we're using our sensory organs to help our body relax. Lavender, chamomile, and other types of essential oils are used in aromatherapy to help our body learn relaxation. A favorite of mine, biofeedback. Biofeedback techniques involve monitoring physiological responses like the heart rate, muscle tension, and learning to control them. I've done this actually, it's pretty cool. I've done this while hooked up to a blood pressure machine, and it's pretty amazing how you can use your breath work to slowly reduce your heart rate. It's pretty impressive, and it's effective. There's also yoga, tai chi, art, creative expression, mindfulness, meditation, hiking and nature trails, right? Going outside, connecting with nature, taking your shoes off, connecting your feet to sand. These all sound kind of very woo, but they're very impactful in using our physical body to regulate the mind. So in terms of techniques, relaxation techniques, I also want to talk a little bit about therapy, and I will give a personal testimony on that end, not in a domestic abuse situation, but in some anxiety provoking situation where I was actually, when I was in residency, there was a time where I've not been given the spirit of fear, but of power, love, and sound mind was a mantra for me for like a whole period of a whole year. To have words that you believe in, that you have faith in, repeated to you can be very empowering. It can be very relaxing. It can break anxiety if you're in an anxiety phase, especially if you're a person of faith and those words, those scriptures mean something important to you. Absolutely 100%. Thank you so much. Okay. So I want to talk about another approach to healing a little bit. I'm going to slow down here. So I've talked about the relaxation techniques, and those are things that we can do on our own. Those are things we can do on our own. However, healing and accessing our own beautiful self and beautiful mind involves often a team. It's not something that is often done alone. So we often recommend therapeutic approaches like talk therapists, working with a therapist, accessing a therapist to help the process while the person is going through, as well as the process of recovery while the person is outside of the situation. And I wanted to talk about this because many times I've talked to people and they say they are going to therapy. However, not all therapy is created equal, and not all therapy is the same. Therapy is a specialized technique. It's not like talking to your friend. If you're going to a therapist and you're just talking to your friend, it's probably just not a very good use of your time. There are different therapeutic techniques, and of the ones that are the specific ones I usually recommend people to look for if, you know, a person is going through like a traumatic situation, domestic abuse situation, whether processing it through it or outside, could be cognitive behavioral therapy. And it's a style of therapy that uses the connection between our behaviors, our thoughts, and our actions to help us process things and to understand things, and sometimes to change our behavior. So I'm just going to list it out there again. It's cognitive behavioral therapy. There is also EMDR, which is very, very popular right now for processing trauma. EMDR, it's eye movement desensitization and reprocessing. So if you're looking for a therapist that's trauma focused to process trauma, you want to look for someone who is skilled in CBT that I mentioned earlier, or EMDR. Supportive therapy is good. I want to say supportive therapy is good when you're going through something, just to help you understand the situation and feel good through the situation. But when you're at a point where you want to make a change, you want to get out, you want to start looking or you want to treat the trauma, you want to start looking at these specific trauma-focused types of therapies. In addition, counseling and different types of counseling to support the person through this situation. Absolutely. And also group. So like the therapy can be, individual, or it can be group. And I want to also highlight the power of the group. If we travel together, we go far. And the importance of going in a group is that when you're receiving therapy in a group setting, first you realize you're not alone. And when you realize you're not alone, it helps with the shame. Because when you feel like, oh, I'm the only person this thing is happening to, it must be something terrible about me. And then you meet 10 other people, it can be quite empowering. It can be quite helpful to change perspective, to understand that it's nothing to be ashamed of. It's not your fault. And you can support each other through the process. So I really also highly recommend group therapy and support groups of different types for this. Last but not the least, I also want to bring up medication. It's a thing that we shall not speak of. Actually, we will be speaking of it. I'm a psychiatrist. I do prescribe medications. In some cases, right, after doing relaxation techniques and journaling and all the things we can do individually to regulate our nervous system, after going through counseling, and including faith-based counseling, right? Whether it be support groups at the church group, faith-based counseling with a faith-based counselor, cognitive therapy, EMDR with a trauma therapist. Sometimes after doing all of that, or especially in the beginning, after being exposed to danger for a long time, it can be very hard for the nervous system to regulate itself. So sometimes we need medicines to help the nervous system regulate until things calm down. And then, each person can use all of these techniques more successfully on their own. So please, if your therapist or if you are talking about this is recommending medications, don't be afraid of medications. I think there's a lot of justified fear out there when people think, oh, they're just going to pump you full of medications and you're just going to become a zombie. I think that that's a lot of fear-based assumptions. There are ethical psychiatrists and practitioners out there who care about people and are judicious as well as fair in how they prescribe medications to help a person regulate their nervous system while they are working through the process of recovery. So medications are indicated, and many times they are. Please consider speaking with a professional or your primary care doctor as well. Are skilled in helping to use medications to regulate the nervous system to help recover from trauma while going through it as well as after the fact. I'm going to stop here and highlight the importance of seeking professional support, highlight the importance to seek a team. It's important not to do this alone. And as a follow-up to that, I'm sharing some hotlines and support organizations that are out there. Of course, first on the list in New Jersey is TouchLink, the organization that has put this together as a resource. There's the New Jersey Coalition to End Domestic Violence. There's, Second Floor Youth Helpline. There are different organizations whose jobs, whose focus, whose priority is helping people through these situations and out of it. Through these situations and out of it. If you are someone who is going through domestic abuse or having similar trauma, I highly recommend reading. Reading could be the beginning of understanding what you're feeling, how you're feeling, what's happening to you, and how to begin the process of stopping that from happening or getting away from it. I highly recommend The Body Keeps the Score, Brain, Mind, and Body in the Healing of Trauma. It's written by Bessel van der Kolk, and it's a highly regarded book in the treatment of trauma and understanding trauma. So if there's one book I would recommend for someone in this situation or someone trying to help someone in this situation, The Body Keeps the Score. And it's available in audio format as well for people who listen to books. But for additional like reading and understanding, that's a book. There are a few others that I've listed on the PowerPoint as well. And yes, please feel free to take a screenshot of the list. I know that there's a lot of resources that has been shared today. Please feel free to take a screenshot so you can consult these resources later or refer back to them. All in all, I really want to emphasize that each and every one of us is created uniquely. And scientifically, we know also that this is so because our DNA is completely unique to us. Between our DNA and our environment, there's never been a person like you, and there will never be another who has the combination of your DNA and your environment and experiences. And so that should remind us or let us know that we are beautiful, we are unique, we each have something to give to the world. However, if we are in situations of abuse and trauma, it makes it hard to be that person. It makes it hard to display our unique talents. It makes it hard to be who we've been proposed to be. And so I want to give encouragement to anyone who's going through a situation like that to recognize their own value, to understand the beauty within, and to seek help and support and team to help you become who you have been created, who you've been designed, who you have been proposed to be. You are beautiful. You are beautiful. Never ever forget that. You are beautiful. And part of the first steps to recognizing and actualizing your own beauty is healing from damages, trauma, highly heightened nervous systems that's causing trouble in relationships and so on and so forth. So I'm going to stop here today. And thank you so much for listening. Thank you for listening. Don't forget to share this with a friend or two. Until next time, it's Dr. Bolanle on the Bright Minds MD and Your Mental Health podcast. Ciao.